The thing is that if Sandarpana, especially obesity, is Sandarpana Janya Vigara, so the person wants to come here, from the day one, he should not allow to sit and relax. We work them. We give them 2 or 3 massages, we give them tell them to walk and eat less food. I mean, eat good quantity food but less nutritive value food. Last month we had 2 people. She lost around 14.5 kilograms.
14.5.
And her husband lost around 15 kilo in 2-3 weeks. Because they follow all the things.
Welcome to our very first episode of Western Doctor meets Ayurvedic Doctor. In this series, we're discussing specific health issues, bringing to you the unique holistic view of Ayurvedic medicine for each of them. Welcome everyone. Today I am sitting here with Dr. Bhadran CK. Dr. Bhadran is an Ayurvedic doctor with 12 years of experience and is currently overseeing clients here at the Ayurvedic and Panchakarma clinic in southern part of Kerala. He has more than 10 years of experience in clinical Panchakarma, dealing especially with patients from Europe. He specializes in obesity and other lifestyle disorders, skin diseases, particularly psoriasis and eczema, joint diseases like rheumatoid and gouty arthritis, degenerative diseases like osteoarthritis, geriatric diseases like Parkinson's disorder or insomnia, and lastly also has abundant experience in mood disorders and depression. Dr. Bhadran, before I begin, I would like to say that I'm very grateful for your time and willingness to join me for this video series.
My pleasure.
And welcoming you here. Thank you.
Thank you.
And before I begin, to all the viewers, I apologize in advance for my nervousness of doing this first video showing through the sweat. It's also very moist today. It's yeah. So coming to our topic of this day, obesity. Right? When studying for this topic, I came across your article where you discuss obesity. So, Dr. Bhadran, in your article you mentioned a certain vicious cycle in obesity where people are in one way feeling hungry and they do eat more, but due to blocked metabolism at the fatty tissue level, the body signals back that it's still hungry. So no amount of eating can satisfy them. And then you mentioned that putting such people on a restrictive diet alone won't work, but will actually aggravate the symptoms of this increased hunger more. So, on the other hand, if they continue to eat, they only increase fat and gain weight. It's like a vicious cycle where a certain, you could say, intelligence of the body has been lost. Could you comment on this a bit more?
Sure. First of all, I should say what is obesity term in Ayurveda is Medo Roga, it's Durmeda or Adimeda, you can say Meda. You know the Sapta Dhadus, Rasa, Rakta, Mamsa, Meda, Asti, Majja and Shukra.
So these are the seven tissues.
The body tissues. So whenever we have some food, it go inside and the digestion, that is for Agni. If the Agni is good, it digests well, it becomes an essence, that is called as Rasa. That rasa, after some digestion from the rasa, from the tissue level, it has to go to recta, blood. From the blood, it has to digest, and the nutritive value go to the mamsa, or flesh. From the flesh, again it has to digest and go to meda, that is the fat. What happened, and then from meda, it has to digest well with a special fire called as dhatu agni. It has to go to asti, the bone. From there it has to digest again and go to majja, that's the bone marrow. From the bone marrow it has to digest well and then go to the semen, that's shukra. That's shukra, final stage. And from shukra it has to digest and go to the ojas, that is the finest energy of the person. So in Meda Roga what happened is, what is happening is you are having appetite, you are eating, but digestion is taking rasa, okay, rekta is going, and from mamsa is going, and from mamsa to meda is going, the fat. From there it stops. Due to the kapha or the shleshmada or the kleda, it stops the channels over there. There is no digestion happening from the meda. So fat is accumulating there, especially in the buttocks, side of it, all the pot. Because it has to digest and it has to go to asti, majja, shukra and oja, then the person is healthy. The thing is that it is stopping there due to the excessive fat, kapha, agni mandya, that particular dhatu agni madhya. So when the channels are blocked there, the kapha is blocked there, the vyana vada and samana vada, it will go back, and the vada go back to the koshta and it ignite again. It stimulates the agni. Then person feel hungry again, and he keep on eating it. But that agni doesn't have the capacity to digest the food completely. That it's only heat is there. You feel the sensation, but it does not have the quality to pajana, to the final nutrition or digestion of the. So whatever you feel hungry, then you get a signal, you go and eat again. Then you put on weight, fatty, water. It is not the digestive properly. So that is the problem. So we have to. That is a false hunger. It's called. So what we have to do? We have to do the sroto shodhana there and dhatu agni. That medo dhatu agni.
And sroto shodhana is
just cleaning the kapha,
cleaning the channels.
Yeah. We have to do the rukshana there, rukshana kriya and langana. When the rukshana, langana and shodhana, then it will show that this the obsession will relieve and agni will be better. Or not only the jadra agni, the dhatu agni. From the medas, the agni get improved. Then if digestion happens, go to next level, asti, and majja and shukra. Then the person weight loss is happening. That is the concept.
So to recap for our Western viewers, basically what happens, if I understood correctly, is there is digestion, the big digestion, the big.
It's called
hunger.
agni.
Yes.
Agni,
which is basically like a fire, right?
Yeah.
So we eat something and then it goes into the tissues.
Yes.
So the food first goes into the plasma, and then it goes into the blood tissue, and then it goes into the muscle, and then into the fat. And on each of these,
you need some fire.
Exactly. So there is like a metabolism happening.
That is what
between each of the tissues.
Yes.
And what you're saying is that when it reaches the fatty tissue, all this metabolism is good, but after the fatty tissue, when it should go into the next tissues, it's stopped. It's blocked.
Because of the lack of that power of that particular fat, particular fire.
Between fatty tissue and then the next tissue.
Yes, right.
And then what you said also is that you have to cleanse the channels and stimulate this fire.
How we do that is because of to do exercise more, sweat more, langhana, and gets good sun or just do more walking. Then automatically when the sweat is there and the langhana is there, then the fat burns out and slowly it clears.
And another thing is that you also said is basically because of that blockage at the fatty tissue level is why body signals a sort of a perverted desire back to eat again, even though they have all the nutrients.
But that's vada. This air is blocked now, so that air confused, it cannot control that, so it comes back to the koshta again, and it stimulates the agni. So fire, the fire will be there. That fire doesn't have the quality to digest again. So next food what he take again, it won't be that much developed again. So it is not digesting further properly. It becomes rasa, rakta, mamsa, meda, but in a slow pace.
Just a question. When it comes to this block in this fire, right, this metabolism, why? Why did this happen? Is this due to some toxins in the system?
Because of the kleda, kapha. Because rasa, rakta, mamsa, until that it was clean. It was not heavy. From the medas, it is kapha is more. Kleda, we can say some slimy thing or sneha amsha. So this, you think that this is a vessel or this is a srotas, something is sticking there. But it is not going up. It's called rodha or sangha, obstruction. It's like a drainage. If water drainage is there, if something heavy things block that, all the system get blocked. Then we have to open it and clean it. Then only it start going again the same way.
So in a way, this is because of overnutrition and improper lifestyle, right?
Yes. These are the things I told. That mainly improper lifestyle and food. Lifestyle means not doing any physical work, but eating more, and so sleeping in the daytime or sleeping all at the night, and not doing any physical work, not any kind of work, physical work, and not taking any stress in life. Like I don't worry about anything. I have money. I don't have to worry anything. So that is also important.
So to have some challenges in life.
Some
also,
challenges in life, it should not be Adi Chintana.
Very
Chintana, not Adi Chintana.
Yeah.
Adi Chintana is a big problem. Adi Chintana become Vada, stress and other at the other purpose. That when we talk, we'll explain. But should think little bit.
Yeah.
What is my life aim? When you get up in the morning, you should have some challenges. No, I'll have to face this one. I have to finish this work.
Yeah.
These people, what happened? They don't know. Yesterday, I just beer or some heavy food. Next the morning, they get
watching
up.
TV.
No, they get up. What is that? And they'll eat. They simply relaxed mind.
That's very interesting. And also, it reminds me of the Chinese medicine. They have the concept of yin, which is accumulating, right? And yang, which is dispersing, it's going out. And I feel like the Western world in general is more yin energetically. They are just accumulating constantly, but they don't have any. They sometimes lack purpose. They sometimes lack like some reality of life and some challenge in life. Yeah, that's interesting. So. But is there also sometimes like some toxins in the system that happens?
Definitely what with the Srodha Avarodha. If the channels are blocked, it becomes the toxins. It's called toxins only. The kleda is called toxins only. Then we have to do the toxins out through Lankhana, maybe the Shamana. We have to give some Shamana Aushadha or we have to do the Shodhana. The Shodhana and Shamana depend upon the person's strength of the person.
So just to explain, Shamana is pacifying and Shodhana is cleansing.
Yes, Shamana is just Na Shodhaya Doshan means it's a sloga is like just we are not taking the dosha from the root and taking it out. Just suppressing it. Something is coming up, just suppressing it. Just tell them don't get up, you sleep there. So they sleep for some time.
Yeah.
We can say people no, you sleep for some time, don't get up. We can say that. But Shodhana means we are just taking it out from there. Don't come ever to this place. Just taking it out. Just taking it from the root. That's called Shodhana. But Shodhana cannot be done for every person. We have to think about his Agni of the person and Bala of the strength of the person. So it is not for everyone. That's why.
So you're looking at the fire of the person?
Fire of that and Bala of the strength of the person. Sattva Bala, Manasika Bala, Manobala, like he's Sattviga or Ramasiga Rajasiga and he's Murdubala or Madhyama Bala or Avara.
So you're saying also you're looking at the mental,
yeah. Because we have to,
as well.
we have to tell we are going to clean you. You are going for toilet for 10-15 times. Then you should follow the diet in that particular day. Then if you say okay, I can do that, and then I know that his Agni is good, then we can plan.
Yeah.
If some people no, I cannot do all the things. Avara Sattva, I cannot. I am not believing that, or I cannot take this much. Then we cannot give.
Interesting.
It's like, I don't know. That's why I told Panchakarma, if everyone come and say, I need to do Panchakarma, it's not possible to do Panchakarma. It's like surgery only.
Yeah.
We cannot do for every person, okay, come surgery, we cannot do like that. We have to consult and assess the condition and prepare the body. It's a long procedure. Actually, it will take more days, but in the present situation, nobody have more time. So we are collaborating it and just making it in another form and practical Panchakarma.
Interesting. So basically every person that comes in, you don't evaluate just the disease, but you actually evaluate the patient as well, which is known as Rogi Roga Pariksha.
Yes, Rogi Roga Pariksha. We have to find what is imbalance, which dosha is having problem and which dosha is having problem, and Agni, how the Agni is there. The Bala is there, then we plan the treatment. That's what we do here. That's why whenever a patient comes here, we'll talk to them. First we'll make them comfortable. Let them sleep for good time. Make them comfortable and we'll ask some questions. We'll have a talk. Then we'll educate them a bit what we are doing here. Because many people doesn't know about Ayurveda. They just believe and they come. So 70-75% people know something about, but some people we have to educate them. So we educate them what is Ayurveda, what are doing, what is imbalance in a different way, and we assess their healthy condition, and we have a body examination. After that, we plan the treatment for them. Minimum 21 days. 14 to 21 days is the first time. If you are coming, 21 days is minimum. Because first 1 week we prepare the body to get Shodhana or Samana, whatever thing. Then next week we do the Panchakarma, mainly the Shodhana, Then after Shodhana, we have to Samsardana, we say. We have to because after the Shodhana,
build the body back,
after
right?
Shodhana, the Agni will be low, then we have to bring the Agni again slowly. That's why it's important to follow the diet. Some people they say, come and say, I need to eat fish or some people it's okay. Like the Agni is good and if the disease is not that, we can tell them you can have it. But for some people, if they have more toxins or you need some deep Shodhana and some skin disease and all, you should tell them better not to have it. And some people, if Sandrapana Janyavadi, if more Brahmana is there, we have to do the Langana, then we can tell them to go for Atapa Sevana, like sun bath and swimming. But no, it has to be restricted, not from 11 o'clock to 3 o'clock we don't send them. Extreme sun is there. I told you, it's again Ayoga or Adiyoga of the sun. So you should tell them to go in the morning session or evening session. So the thing is that if Sandarpana, especially obesity, is Sandarpana Janya Vigara. So the person wants to come here, from the day one, he should not allow to sit and relax. We work them. We give them 2 or 3 massages, we give them tell them to walk and eat less food. I mean, eat good quantity food but less nutritive value food to pacify his Agni.
So good quality but less nutritive value.
Yes, it's called Guru Apadarpanam. Heavy but Apadarpanam.
So heavy but less.
Light food because we make a good big combination give them. Like a big soup or something or big salad and porridge, something like that. So usually the person last month we had 2 people. She lost around 14.5 kilograms.
14.5.
And her husband lost around 15 kilo in 2-3 weeks. Because they follow all the things strictly. I told you, Chikitsa Sadushpada. Doctor, patient, nurse, or the master and the medicine. These 4 things should be in good quality. If anyone is in that is not working properly, then the result will not be there.
So when people come for Panchakarma and they suffer from obesity, you already explained now, you give them different type of treatments like 2 times a day they receive a massage or are there any other treatments that they receive?
Not only massage, we say everybody know only massage. Massage in different type. Udvartana is there. Udvartana.
So Udvartana is what?
Udvartana is a powder massage. It's a specially herbal powder. We made about more than 10 to 11 ingredients. We make a good powder and that powder is having rukshana. Rukshana means dryness. It makes the body dry. Because in Medas is very fatty body, so we have to do opposite thing. Udvartana is a procedure taking the powder against massage against the hair root. So upward movement massage. So what happens is the lymph drainage will be better and it clears the skin and open the sweat glands to the hair root. So through sweat the weight loss is happening and open the channels. It's Ayurveda say Udvartana is a technique. Udvartanam kafaharam medasaha pravilayaram sthirikaranam anganam tuk prasadakaram param. Udvartana is kafahara. It is again kafahara. Medasa pravana means medasa means is fat. No, it makes liquefaction of fat. Fat will be very thick. So when we do the massage, it becomes little loose. Then through sweat, the loose comes out.
So this is basically what you were saying before, is opening the channels, cleansing the channels. So you do dry massage.
Dry massage, opposite direction of the hair.
In the opposite direction, and is that
then
like
it creates a heat in the body.
So and then it opens up the channels. It also liquefies the fat. And then through sweat they start to lose.
Not in one day, slowly, gradually.
That's interesting.
It's Udvartana. Udvartana is a Udkarshana is there. Some Ruksha, the oil, sesame oil with some Ruksha quality of herbs. It's called Ruksha Taila, like Chinchadi something we use.
So you also do use oil massage?
Yeah, oil with the powder. It's called Udkarshana. Because little bit, some people after 2-3 days the dryness become more, then we have to do Udkarshana. And we have Dhanyamla. Dhanyamla Dhara it's called. So Dhanyamla is I don't know, like a rice water, like a Amla Guna. It's against the Kapha again. So that also we do.
So Dhanyamla Dhara, for those of you that don't know, is
if Kapha Avarna is there, Kapha is high, we have to do Dhanyamla Dhara.
It is a form of a fermented
rice,
liquid, fermented rice.
Rice, not only rice, some other grains also there, some herbs also there.
And it has a very pungent, very also an acid
Yes, acidic.
effect on the body,
Yeah.
and that again it opens up these channels.
It again liquefies and it clears the channels, and after the dhara the person feel lighter, body feel lightness. It's immediate. It's not. It's very instant. After 2 or 3 days, the person feels that I feel shrink, I feel lighter. Yeah. But if I give you for other person, if it's pitta person or something, then he cannot tolerate. He get angry. Because amla guna is there, acidic is there. The pitta person we cannot give. So the diagnosis is important.
Interesting. So again, coming to the individual way of treating people. So so this is one thing. Are there any other treatments?
I told no Udvartana, Utkarshana, Dhanyamla Dhara, and we have called key pouch, herbal pouch. We can do Valuga Sweda. Valuga means sand. Dry sand, we make a pouch and heat in the dry sand, heat in the gas and keep the hot and keep it massage here, stamping. It also gives the heat, that pressure, and liquefy the fat.
Interesting.
That's called Valuga Sweda.
So basically hot pouches filled with sand, and then they get bumped all over the body, and then again they liquefy. But I have also seen this big chamber here that you put people in.
That's Swedana. That is Swedana. Swedana is I don't. Swedana is important. Rukshana, Swedana, and Langana is the important treatment of Ayurveda. So Swedana is that Valuga Sweda itself is a Swedana. And Dhanyamla Dhara is a Drava Sweda. It's kind of a Drava Sweda. Dhanyamla Dhara, because we are pouring warm water. No? Then this is a chamber. It's called Bashpa Sweda. We will do a massage and keep it in the chamber. So we do a certain number of steam. So you get completely sweat. Whole from head to head to toe, you get completely sweat. So channels are open. You feel much lighter. That's also it.
Are there also any internal treatments or medicines that you do for people with obesity issue?
Yes, we have to do. Maybe we can do Nitya Virera kind of thing. We have to do Nitya Virera, like Triphala, Churna we can do.
Nitya Virechana, that's what kind of a treatment?
Treatment means the person also having more kapha, we can do the Nitya Virera, like Triphala. But,
Triphala, the three fruits.
Three fruits.
Yeah, it's very known.
It is very good for eyes, and it's good to it rukshana, scraping effort in the stomach. So every day cutting off of the kapha.
So are there any other internal medicines do you give, like traditionally? What would you give?
So other medicines, especially we can use Chedana and Lekhani Aushadas. Chedana means Sishtan Doshan Kafadigan Bahir Ulmula Yadbala Chedana Tadida Shara Nira Mushtam Batayava. Means Kafadiga Dosha. If the Kafa, I told you the toxins of Treda, the Snehamsa which is sticking on the body, these herbs just scrape it out. That's called hot water. It's a good treatment. That's why I tell them to drink hot water with honey and lemon in the morning, just to scrape it out. And Vacha is a herb. It's good. And Shaudra, honey, and the Shilajutu, and Kshara, all kind of things, and Chedana and Lekhana, Aushadha.
What about complex medicines?
Complex medicine you can use certain Gungulu we can use. Triphala Gungulu we can use, so you can use Navaka Gungulu, 9 ingredients are there. You can use, there are many patent medicines, but classically you can use Medohara Gungulu, you can use, and you can use some different kashaya. Asana Viladi Kashaya, you can use Varanadi Kashaya, you can use Panchapitta Kashaya, all the kapha are Pitta, Kadu, Rasa, Pradana, Aushadha you can use, Ushnavira. There are many combinations. I cannot say this is the best medicine for one person. People ask me, I need some medicine to lose weight. So I cannot, we have to think the idea. What is this Agni, then we have to plan that. There are many kashayas, many power churmas, and the tablets.
We will show tomorrow with Dr. Bhadran some of these herbs, but also some of these medicines. Because in Ayurveda we have simple herbs, right, and then we have complex medicines.
from
So
the yoga.
based on what
In
people.
Sahasrara there are a lot of combinations. Sahasrara you can find it. And you can have your own combination with the herbs.
So you also mentioned lifestyle changes. So you mentioned that people coming here, you actually say to them.
I tell them not to sit, only sleep 8 hours at night or 7 to 8 hours at night.
Yes.
Daytime maximum you keep moving.
Yes.
You are not supposed to sit. I tell them to walk 3 to 4 hours and 2 hours treatment for 6 hours.
Yeah.
Then 2 hours for they eat some, so 8 hours is there. Then, again do some activities. No, don't just walk here or just go for somewhere. Don't sit. This better not to give.
Because when I came here first time, I saw people, you know, they were walking down the beach, up, down, up, down, and I asked them, you know, what are you doing? They said, no, we were told we need to walk 3 hours a day, and it works.
It was, yeah.
So
Definitely, I don't know. We cannot do any magic here. Yeah, I told you these 4 pillars: doctor, the Persian, and the masseur, and the medicine. These 4 should work together, hand in hand.
So doctor, medicine, patient,
And the masseur.
and the
Masseur.
masseur. Yes.
If I tell the masseur to do this one, and if he do slowly, or if you do something wrong, then we cannot see what is happening. You know? So I'm telling the patient to take you walk 3 hours, you cut off this medicine, the herb food, you take the herbs at proper time. If he is not following, then we don't. And if the doctor is not efficient to handle the situation, and if he is not able to diagnose the situation, then there won't be a result. And if I use a cheap quality medicine, or the medicine which is not which is expired, or which is not having good potency, then it won't affect.
When a person comes for Panchakarma, they get 2 treatments a day.
Yeah.
They do all this lifestyle change. Obviously, you change diet for them, right? They get medicines. Then they lose weight. What about afterwards when they go home?
The thing is that they should follow minimum 3 to 4 months medicines and the diet, strict diet.
And they get these medicines from you?
Yeah. We will give you the medicine properly, and they should take the medicine and the habit also. According to their work when we talk the final consultation, I will ask about their work, what is the work schedule. Then I will make a plan for them. So you should walk at least 1 or 2 hours something exercise every day, and give some medicine to them, and some lifestyle changes and food advice to the work. Usually people send me messages after 5 to 6 months. I lost more than 20 kilos now total overall, and I feel fit. And they used to come every year.
So they keep losing weight?
They keep continuously use. If they follow, definitely.
The last question, Dr. Bhadran. How much on average does a person lose weight in
21 days. So
Yeah.
If it depends. If the person having a good ambition to lose the weight, and if he follow everything, minimum is 8 kilo.
8 kilo?
Minimum, 3 weeks.
Minimum.
Minimum. My experience, 8 kilo.
What was the most amount of weight loss you saw a person lose?
I think 17 kilo.
17.
In my experience, 17 kilo.
Amazing.
3 years
And
before, I think.
So, Dr. Bhadran, with this we have concluded today's interview, and I'm thanking you again for your time and for all the knowledge that you shared with us.